So my name is Steve Kane, and I'm a cornea specialist in the Clearwater, Florida area. I've been practicing there about 2.5 years, and I take care of a lot of complex cornea patients. When looking for treatment options, I think it depends on the disease in front of me. So many patients that I see have already seen several other doctors and have been referred to me because they failed previous therapy. And so if the patient is, say, a recurrent erosion syndrome patient, and they have had recurrent erosions for a long time, and they've tried bandage contact lenses, and they've tried hypertonic ointments, and it really failed all these treatments, that's when I start looking for really powerful, non-surgical, non-having to go to the OR options like a PROKERA amniotic membrane graft, which can rehabilitate the corneal surface without having to go to the operating room. In my fellowship training in University of Pittsburgh, we used a lot of the dehydrated membranes, which are typically placed under a bandage contact lens. And there can be issues with the placement in terms of keeping them on the cornea. And in my experiences, they never really performed better than standard contact lens in terms of healing challenging corneas. Counter to that, the cryopreserved amniotic membrane tissue really retains a lot of the natural properties of the tissue and performed much better when the patient had failed contact lens or failed ointment, was able to heal these complex corneas. Yeah, my wow moment happened a few years ago. There was a patient referred to me who'd already seen several cornea specialists, and I think I was the third or fourth cornea specialist in the lineup. This patient had a neurotrophic melting corneal ulcer from active herpes virus. Unfortunately had been on steroid, which had accelerated the melting, and by the time I met the patient for the first time, he was about 90% thin in about 80% of his cornea, so he was in big trouble. Because of the patient's medical issues, I was not able to take him to the operating room. He was also, of course, wheelchair bound and in an ALF, and there are many complexities to this patient's case, but I offered him treatment with PROKERA amniotic membranes, and it took more than one. However, we were able to heal this patient's cornea beautifully without taking him to the OR, obviously stopping the steroids on the cornea, but the PROKERA amniotic tissue was really powerful in terms of turning around this patient's disease course.